National Institute for the Empowerment of Persons with Intellectual Disabilities, Divyangjan, Secunderabad, formerly NIMH Secunderabad, has developed this kit on creation of awareness on prevention and early detection of disabilities kit, awareness kit developed specifically for the grassroots level personnel, workers working in the rural areas, Anganwadi workers, Anganwadi helpers, ASHA workers, ANMs, and multi-purpose rehabilitation workers, volunteers, health volunteers. Anybody can be using this kit. This kit is specifically designed for the grassroots level personnel to go to the villages and identify children with disabilities and create awareness on care to be taken by the pregnant mothers. The kit has 4 contents. In that, one is a flip chart which is enclosed in this blue cover. The flip chart has multiple awareness information. Then we have two boxes, box number 1 and box number 2, which has 30 posters each. Then we have a color coding chart which will be used by the Anganwadi workers. I will explain how this kit has to be used. This eco-friendly jute material bag is specifically designed for the Anganwadi worker or the grassroots level personnel to take this along with them to the project area, then use the contents that are given. The first one I would like to explain about this flip chart. It is a tabletop flip chart which can be stationed on any table and it can be easily explained. This flip chart is specifically designed for the villages, the community, the public, the general public, students and teachers and many other members of the community. So this flip chart has all the details of identifying a child with disability by showing introductory aspects of what a normal child can do, then what a problematic child having some developmental delay cannot do. Then there are explanation related to what is disability. Then a brief explanation about what are the causes of disability. We can see that each photograph or picture has an explanation behind. So it can be read. Even a grassroots level person taking a lecture or a small awareness program, they can clearly read out what is there in the backside of the picture mentioned in the front. So it will be easy for an Anganwadi worker or any grassroots level person to undertake a awareness program for the members of the community or members of the panchayat, members of the self-help groups, or it can be a parent group, or it can be a group of pregnant mothers. So this tabletop flip chart will be useful for them. So this flip chart also has contents related to problems that are seen in children with developmental delay, then about the normal development and care that has to be taken by the pregnant mothers. Then small pictures related to how a child with developmental delay is seen. Then how does these children with intellectual disability or any other developmental delay manifest their problem, how we can identify, what are the red flags related to this. Then in that individual level, like if the child has visual problems, how the child will be behaving is mentioned. As I told you, each picture has a reading material in the backside which can be read so that it will be easy for the grassroots level person to take an awareness program. Then this is related to, the chart is related to intellectual disability, the behavior and identification part. Then this chart is again related to rehabilitation process of a child with developmental delay. So this is the end. The other contents of the eco-friendly bag has 2 boxes which are numbered as 1 and 2. Each box has 30 posters each about pregnancy, care and also identification of developmental delay. So when we go to the box number 1, the chart is about the care that has to be taken during the pregnancy. The Anganwadi worker or the grassroots level personnel is expected to go to the home of every woman who is pregnant and explain her this chart. Like the first part is to maintain proper schedule, breakfast, diet in which a balanced diet has to be taken, having meals with family, consulting doctor before taking any medicines, or keeping the surroundings clean, avoiding strenuous work or lifting any heavy objects or walking on slippery surfaces. And she is also has to be advised to maintain friendly relation with the neighbors during the pregnancy. So this chart has to be explained and the same has to be handed the pregnant woman's home so that other members of the community, other members of the family also can read and get them sensitized. The second chart is about identifying the red flags in developmental delay, right? So we need to ask these questions. The grassroots level personnel is expected to go to every home where there is a child below 1 year and ask these questions or directly interact with the child, whether the child is responding to the loud noises, whether the child is blinking to the light, whether the child is able to walk or do any activity that is related, comparable to his age, whether the child is holding his head even at after the age of 5 months. So these are few red flags that have to be explained, and that chart has to be handed at the child's home where these red flags can be visualized by the family members also, and any problem noted, any developmental delay can be immediately informed to the concerned authorities and appropriate referral can happen. Sure. The third content of the jute bag is a color coding material where you can see different color stickers. So these are 3 different color stickers which are also enclosed in the awareness kit. So these stickers can be used for easy identification by the Anganwadi worker. So whenever the grassroots level worker visits the locality and meet any pregnant woman, so just beside the pregnant woman's name, the red sticker has to be sticked. Okay. Then if the grassroots level personnel has identified any child below 1 year, this green sticker has to be sticked just beside the name of the child. Then the blue sticker in case any child with developmental delay or established disability has been identified. So this will ease out the identification process while during the meetings at the district level or at the mandal level or at the block level, the Anganwadi worker or the grassroots level personnel or ASHA worker will find it easy to note how many pregnant women are there in particular village by just counting the stickers. Other children, 1 year below children, and also an identified person with disability. So that it will be easy for them to immediately refer the child or refer the child with developmental delay or disability, or refer the child who has missed his milestones, or refer the woman who is pregnant to a nearby referral hospital, or whether regular antenatal checkups are happening or not, that kind of information can be given. And a little write-up also is mentioned in the back of this color coding material, which can also be referred. Thank you.